Thank you all for coming out. Dead doctors do lie. Tonight we will be debunking today's medical myths. Some of you guys may have heard the original Dead Doctors Don't Lie. That is Dr. Joel Wallach here, who was previously a farmer turned veterinarian. Has some interesting theories and things that he talked about here. This was booked back out in the 90s here. Originally he was talking about how the lifespan in the 90s was 75.5. He said the typical MD only lived to 58 years old, and he had some interesting things that he talked about with that there. But the key thing that I want to talk about here is he talked about the 91 things that we always talk about pretty heavy in our office here. 60 of those being minerals, 16 vitamins, 12 amino acids, and 3 essential fatty acids. I always talk pretty heavily about a lot of things that are going on today being correlated to mineral deficiencies, and seeing this being a veterinarian that a lot of these issues weren't problems with animals because they added the minerals to the feed, and that today a lot of the soil is depleted of minerals. I'm going to prove to you at the end of this lecture that what he has said has stood the test of time, and it's still true today. I am back with a vengeance tonight. This is the new office. If you guys haven't been to it yet here, 10 miles right through here, and it's Kerman Boulevard, and we're in the back and through here. Awesome office through here. It was a plastic surgeon's office prior to that. They dumped a lot of stuff into it there, granite countertops and all that. It's just a state-of-the-art office here. Reward you guys with some of our flood damage supplements here this evening, so enjoy some of those supplements here. A lot of exciting things going on here too. My baby boy was born last month on the 18th there. Thank you. And you talk about minerals in that. I was bald, my wife was bald, and he's got the hair. So the prenatal regimen definitely was working pretty good here. My next lecture is going to be in September. I'll be here. Super bug infections of today. I'm attacking these infections. They are getting nastier and nastier and harder to get under control. A few people have asked me, as far as what the CFMP stands for, Certified Functional Medicine Practitioner. I did not decide to go to the route of a naturopathic physician because that license does not uphold much in the state of Michigan. I pursued a different route and went for the functional medicine program. Later want to go for a diplomate in nutrition. These are some of the lab stuff that I'll be using that a lot of the functional medicine program uses here. And you've seen us use hair analysis stuff with the doctor's data, LabCorp with a lot of the blood work there, Genova Diagnostics. I'm going to get pretty heavy into some of these gut testing things, especially with how rough a lot of these ulcerative colitis cases, Crohn's, irritable bowel, whatever you want to call it today. I'm going to show you in that lecture how we're getting a little bit more diagnostic with some of these things here. I'm bringing back my mini lectures here for this year. I took a break last year, brought them back this year. Surviving Winter, Paleo lecture. Everyone loves the muscle testing stuff. Sometimes at the end of the lecture, if I have some time, I'll pull them so people kind of show some of the muscle testing stuff, how we kind of determine certain things between the clinical testing and the subclinical world of testing of things. Next lecture will be Shop with the Doc. Did that 2 years ago there. It's at Better Health in Novi from 7 to 8 p.m. If you are interested in that, just call the office, sign up for that. I go through the store, show you what's junk, what's not junk. Everyone seems to really enjoy that lecture there. It's just getting some basic knowledge of shopping and looking at foods, and then going through regular grocery stores. It's easy to kind of look around and say, man, half the stuff we're eating is junk today. So if you're interested in that, check that out there. This was the paleo diet lecture there. Wes, there you are right there. All that gray. We've got a pretty big office there as far as being able to do bigger mini lectures within our office. We've got 10 rooms at the new office. I could cram about 50 to 60 chairs in that office, and we got a big screen TV, so we might be doing popcorn movie nights that we were doing here at the office now. And I might be working again there with Mary Toko to possibly do some new information as far as the whole vaccine stuff that's changing Michigan a little bit. So we might be bringing that to the office as well here too. Following tonight's lecture, I'll stay for some questions and answers and stuff that will not be recorded. That's my gift to you guys for coming out here tonight, and maybe some muscle testing too. Our lectures have just been exploding on YouTube. You know, it's funny that we just put these things on here for your guys' benefit. Our crowds are shrinking at the lectures, but these things are just going viral like crazy. DiverseHealthServices.com is our website. I didn't put the address up on that one slide there. Our new address is on the website though. Follow our blog. I get a little bit more active with that, with the little one here and this lecture here. I've been a little quiet on the blog here, but next week and this next month I'm going to start blowing that thing up a little bit more. It's amazing just tracking that blog and just where that's going there too. It's been some fun stuff there. Follow us on Facebook there. I post some things in between the blogs and just, you know, people, it's a social media world today. You could tweet me if you're into that tweeting world stuff there. I'll tweet questions back at you or answers back to your questions or whatever. Been some fun stuff. I like trying to track trends and news and that kind of thing on there. Skype. The Skype stuff's been awesome. I'm going to go through some Skype cases tonight. You know, how did this? People always ask, how did you guys get into Skype? Why did this Skype stuff start? You know, we've had patients that lived out of state, family members were trying to help, friends and that, and they're always like, who does what you do in this state? Or they're here and there. And we try to make some good referrals and just never seem to pan out. We're like, you know what, let's just start doing Skype visits. And you know, what we do in our office seems to be that limited, and people come far away for our help here. So it's been very cool. The YouTube stuff's really driven our Skype stuff, and we're Skyping patients in state, out of state, even out of the country. So it's been very cool, the amount of help we've been able to give people all around the world. And this was one of the ladies who came to me last year for some help. 40-year-old lady from Texas, diagnosed with ankylosing spondylitis in March, started with symptoms of uveitis last year, pain in the eyes. Her MD said her RA factors were up, but she had no symptoms. MD said, well, it was an autoimmune issue attacking your body. Shortly after, she started with the neck pain, knee pain, feet pain. Feet were getting worse. She's having a hard time walking. Ran some other blood work, and the HLA B127 marker was also elevated too, which is kind of an indicator of ankylosing spondylitis, which is a condition kind of calcifies the spine, and people get this stiff, rigid type thing going on. It's not typically an autoimmune issue. This is a great learning case of treat the patient, not the lab work. Treat the patient, not the lab work. It's easy to pick some of these blood works up and, you know, just fine tune, oh, it's your thyroid, it's this, that, tweak this, tweak that, come back to me type thing. Real doctoring, you want to treat the patient, not the symptoms. I saved her from a rheumatologist because her rheumatologist just start the steroid train, start the methotrexate. It just was going right down that road here. Her biggest issue was a pH issue. Calcium was building up in her joints. She was drinking the wrong water, and some of that wrong water, that calcium was building up in her joints and creating a lot of this pain. What I did, simply explained in a nutshell, if you take a pot of water and put a calcium tablet in it, and it was dissolving and the calcium was building on the outside of the rim, in order to get the calcium off the rim and back in the solution in the water, put a tablespoon of vinegar in there and brings it right back. I did that internally with her with supplements to get the pH balance to pull the calcium out of her joints. She was 90% improved with her feet and her joints just by this alone. Now, yes, she did have some autoimmune markers up there, and then we ran a viral panel. We attack a lot of these things as a viral issue, but I barely even had to get to that road because the majority of her problem was a pH problem there. And she was just going down the road of medicine. You know, it's getting to the point of using chemotherapy type agents attacking some of these autoimmune conditions. That was a very cool case.
She actually came to Michigan to see you.
She didn't. I just fixed her over the computer. This is Skype right here. I got another cool case of Skype that I'm going to kind of jump into in the middle of the lecture here too. This is great here. Physicians want Dr. Oz gone from the Columbia Medical faculty here. Dr. Oz has repeatedly shown disdain for science and its evidence-based medicine, said a letter the 10 physicians sent to Columbia Dean earlier this week. This was back in last month here. They said he's pushing miracle weight loss supplement with no scientific proof that they work. This is great. I could always tell who watches too much TV because when he was pushing raspberry ketones as the miracle thing for weight loss, we had 1 million people calling our office. You carry raspberry ketones, and we're like, why is everyone calling our office asking about raspberry ketones? Weight loss is a big selling factor. Dr. Oz plays both sides of the fence, the alternative side and the medical side. He ends up playing them both too much back and forth that he ends up pissing off both people on both sides here. When you look at the weight stuff and going over weight loss stuff drives up ratings, so this is why a lot of his shows tends to be weight loss stuff. He mentioned genetically modified foods. You got to start asking, well, what's in our food that's creating issues that America has weight issues? And when he started talking about genetically modified foods on one of his episodes, this is when this whole thing just started fizzling down and everyone, these doctors were after him. Now, I posted a video on our YouTube link or on our Facebook link that some of you guys may have seen. If you haven't, I suggest you check it out. On one of his episodes, he addressed his critics. After being in the news and the media for all this stuff and being pounded after this, he addressed his critics, and this is absolutely phenomenal. A few of the doctors that were absolutely after him here, he did a personal investigation on every doctor who signed that letter on him. In a nutshell, this is one of the doctors here, Dr. Henry Miller, who gets paid by tobacco companies, companies that support Monsanto and the genetically modified foods, and he gets paid by pesticide companies to push their stuff. This is what you call a rent-a-doctor. Rent-a-doctor, give him enough money, he will say, yes, there's enough research to support genetically modified foods are perfectly safe, and I think it's the way of the future. Here you go. Great video, absolutely got to watch him, how he just went through one after one. And one of the doctors was a felon. He's a felon. He shouldn't even have a license.
That was on YouTube?
Yes. If you go on our Facebook link, I scrolled down, I posted that video there. Astonishing. So one of the things I'll go through with the shopping tour here is the top 10 genetically modified foods. Obviously, it's getting warm and that kind of stuff, so people will be eat more of these foods. I'm going to be talking about these gut issues. If you watch the documentary Genetic Roulette, you'll see issues of what's going on with the genetically modified foods and why they don't allow this stuff in Europe. Monsanto, PepsiCo, and another chemical company doled out about $53 million to defeat the bill in California that was going to label if it was genetically modified or not. That's how much it meant for them to keep that off those labels. All our foreign patients come in our office. What's in your food? Because my stomach hurts all the time and I'm gaining weight like crazy. I can't tell you how often I hear that, and I say it repeatedly in my lectures. They don't allow these things in European countries. And on the Genetic Roulette movie, you'll see charts showing ever since the mid-90s how they've incorporated genetically modified foods in the mid-90s with the Roundup Ready stuff, and all the charts of irritable bowel disease as far as Crohn's and ulcerative colitis have absolutely gone through the roof with this. Not only in that movie, they show some other pretty cool things of pigs being completely fed genetically modified corn, having all these health issues and health problems. As soon as they switch them to just organic corn, all the health problems disappeared in 2-3 weeks. Pretty impressive documentary there, Genetic Roulette. Now, the Dirty Dozen. I will pinpoint people coming in here. I'll know who's eating the Dirty Dozen foods here that are filled with the most pesticides, because I'll have patients come in here complaining about dull, nausea, and upper left-sided stomach pain. You could beat your liver up all day long and it'll keep going. You irritate your pancreas and it's going to let you know nausea, vomiting, and pain on the upper left side. It does not. Your pancreas doesn't like herbicides, fungicides, pesticides, alcohol, smoking, NSAIDs, ibuprofen, Motionavil, Tylenol, other chemicals, too much sugars, all these things will irritate a pancreas, and especially the pesticides will get to the patients and irritate their systems. Also has an estrogen mimicking effect. Breast cancers, prostate cancers have all been correlated to issues with pesticides. Vaccine bill passes the Senate, passes into the Senate here. This is what's going on in California here. This is a heads up for the Michigan people, because what's happening there will soon eventually be happening in Michigan. A controversial bill that would eliminate personal belief exemption from vaccines passed the California Senate Judicial Committee here. They're trying to eliminate religious beliefs as far as a waiver to get out of vaccine exemption here. Now, people are losing their rights slowly and slowly right in front of everyone. This is happening with the healthcare workers. A few years ago, nurses said, okay, I'm not going to get the flu shot. Okay, not a big deal. Next year, well, if you don't get your flu shot, you got to wear a mask. Okay, well, I'll wear a mask. This year, well, you know, if you don't get a flu shot, well, we're just going to fire you and look for the next nurse who's going to get the flu shot. This is what's going on here, and this is slowly going to come trickling down a little bit uglier year after year the way it's going here right now. Now, I had to sit in for a vaccine waiver class here for my son because we're going to do some daycare, and I went to the health department, and the health department lady asked me, why aren't you doing vaccines? I said, one, there's no safety studies showing the safetiness of the vaccines. Two, there's no research that supports the effectiveness of these vaccines. Then I said, third, I'm the doctor who treats the vaccine-injured individuals. It's not just autism, it's Asperger's, it's ADD, ADHD, learning spectrum disorders, sensory integration disorders. After I said that, she shut her mouth and did not say one word to me. Yes, absolutely. Go right ahead. Now, vitamin D. Everyone asks us about vitamin D here as far as supplementation and summertime goes here. Some people will supplement during the summer. Others will say get outside and get the free stuff. The point is, if you're supplementing with vitamin D during the summertime, you got to know where your D levels are at. We ideally like it between 70 and 80 with patients here. So if your vitamin D is low and you're checking it on blood work, you could still supplement during the summer with the vitamin D. If you're not checking it as much on blood work, we normally tell patients take a break, pick it up during the fall and the winter. Vitamin D is your #1 preventive thing of the flu, upper respiratory infections, small colds, cuts cancers in half, probably the biggest bang for the buck vitamin you could do. We normally have been stopping giving away a lot of our protocols here. This is one of the summertime protocols everybody loves, especially the women. You want to have nice dark brown Mediterranean type skin. Cataplex F pearls of standard process, and coconut oil topically. Coconut oil has a natural SPF of 15. Cataplex F pearls is a flax-based oil. You're playing with calcium metabolism in the body. Sun hits your skin, you start producing a lot of vitamin D. Calcium's needed to metabolize that vitamin D. If you drink too much calcium from your skin and tissues, you're prone to getting a sunburn. The oils push the calcium from the bloodstream into your skin and keep it in your tissues, preventing you from getting burned. Use good oils, you won't have problems. If you got if you're prone to get sunburns, that got the lighter complexion, learn to use a chemical-free sunscreen. The traditional sunscreens are estrogen-based and have a lot of chemical components to it. Allegory of the cave. I always wanted to talk about this and kind of tell you guys a little bit of a story before jumping into what I'm going to jump into. Now I'm going to go through 13 medical myths as far as my lecture here goes. Plato was an old philosopher. This is out of the book, The Republic, and one of the chapters was Allegory of the Cave. This is an analogy of what it is like for Dr. Tent and I to go to work every single day here. Use your imagination and follow along with me here. So you got prisoners here, you got shadows here, you got a fire, you got people walking by, doing a little puppet show or just walking by. Go outside the cave here, you got the sunlight, the trees, person walking in through here. People are born prisoners. These people down here are chained to the wall and they've been born prisoners their entire life. All they've seen are these shadows here. They've seen shadows and they've heard voices from them talking here, saw these shadows their entire life. They think these shadows are real. Dr. Tent and I have broken out of our chains. We walked through here, we got out here, we're through here. We see the sunlight, the sun hits our eyes, we see the shadows in through here and realize these shadows aren't real. This is a reflection from the fire, and we realize this stuff. This is what trying to give knowledge to other people is like. We come back in this cave here. We're down here talking to these prisoners who've been chained their entire life to the wall here. We're trying to explain every single day these shadows are fake. This is a reflection here. This is not real. Some people are going to break from these chains. They're going to walk out and realize this stuff. Other people are going to be satisfied and stick in their own world and say, no, these shadows are real. This is what it is today. So the next question is, what are these shadows today? These are some of your shadows you're looking at here. Google, WebMD. Can't tell you the amount of people that think they're dying of ALS or cancer just from those Google and WebMD coming to me today. Don't search your own symptoms. Please don't. This is just some of the stuff here. And as you can see, light, object, shadow, prisoner. So I challenge you today. Break those chains. Walk outside of that cave. You might not agree with everything I say. That's fine. I don't care. I've seen different things and I've had a different walk. I've worked at a hospital for 4 years. I'm here because I worked there and saw what I saw at a hospital for 4 years. I'm going to jump right into it here. Myth number 1, salt is bad for your health. Not only is the case against salt blood pressure theory unproven, it may have also done some harm. In fact, we need up to consume 3 to 6 grams of salt every single day for optimum health. Now, I always talk about this as the weather gets a little bit warmer. This is how they're going to kill people with their crappy medical recommendations. Your blood pressure is high. You need to stay on a no salt, low salt diet. I'm going to put you on a beta blocker to slow down your heart. I'm going to put you on a Lasix water pill to pee out minerals and nutrients. Then I'm going to put you out in the heat in the sun and see if you don't croak due to heat stroke. These are why the seniors do not like the heat. And I could tell who's on that regimen just by walking around in the summer from that. And I could watch all these athletes who are on a low salt diet because they're going to be the ones who are cramping in the fourth quarter, or these are going to be the marathon runners who are running like crazy, sweating like dogs and falling to the back of the pack because they don't have enough of the good salt, and that's table salt here, but we're talking about good salt to stay hydrated. Water alone does not hydrate your body. You need salt and sugar to hydrate your body. Sugar raises your blood pressure, not salt. They picked out the wrong villain here. People who consume high levels of high fructose corn syrup are 3 times more likely to suffer cardiovascular disease compared to those who keep below a certain level here. It's sugar, not salt. This is what good salt looks like here. This is Celtic salt here. This is what I got in my water here. A pinch of salt in the water is what I use during the summer to stay hydrated. If I'm biking, I'm running, and that kind of stuff, I'm going to use a combination, maybe some coconut water in there too. Water alone does not hydrate you, and I could watch the people who are going to cramp in the fourth quarter, who are just going to completely burn out or get this dull fatigue during the 100 months of summer, and it's a hydration issue there. Now, Dr. Joe Wallach always talked about having a salt lick there for animals, and they don't tell the cow you can only have 10 licks today because you might get high blood pressure if you have more than 10 licks. That cow is going to take as many licks as it wants there to get his salt and minerals, and if they don't have that salt lick there, it starts cribbing. cribbing is when they start gnawing on the fence and eating inanimate objects. You know who else has cribbing issues? Kids with low minerals. They call it something else though. It's called pica. All these kids put inanimate objects, eating dirt, and all these other types of things. To the most extreme case, it's a pica issue. Mineral deficiencies. Simple mineral deficiencies. Knock that out there. Salt is essential for your health, and that's a pink salt. So I'm sure someone's going to ask me later, is that Himalayan salt? No, it's not Himalayan salt there. Celtic salt's better than Himalayan salt from what I've seen from personal experience with hydration stuff. Himalayan's a good salt too, but Celtic salt's what we consider the gold standard there. Myth number 2, high blood pressure is a silent killer. The 8th Joint National Committee recently released a new report on hypertension where the guidelines for diagnosing hypertension were slightly relaxed. The committee recommended that for those 60 years and older, the goal for blood pressure was to be less than 150/90, which was before 140/90 here. As you get older, it's normal for blood pressure to go up. Younger doctors are going to get more aggressive and more nervous if your blood pressure goes up. Taking blood pressure all day long in the office, I see patients 160/90, perfectly fine. Now you watch these seniors and they drop their blood pressure too low, they're tired, they're lethargic, they're dizzy. Heaven forbid they get up, they slip, they fall, and they hit their head and they're on a blood thinner. Look out, that's going to be a nightmare there. I was going to mention one other thing here. Blood pressure, good. Yes, if the bottom number of your blood pressure is the one that's elevated, the diastolic number, that's a kidney issue. Go after your kidneys. You need to find the doctor who knows how to treat a kidney issue. I recently had a patient who was pounding Motrin all day long, destroyed his kidneys, I should say one kidney. He was born with one kidney, didn't even realize he had one kidney, ate so much Motrin for headaches and destroyed the one kidney he has, and it's only at 15% function with one kidney. You talk to a urologist and talk about Motrin and ibuprofen, they cringe, just cringe at the damage that this kind of stuff does to your kidneys there. Tylenol, on the other hand, is the number one cause of acute liver failure. Tylenol will kill the stomach there, and actually more the liver, I should say. Here's the real silent killers. South of the LHDL, homocysteine triglycerides, lipoprotein A, all these other ones down and through here, these are the ones we're concerned about. Those are the real silent killers. And when you look at total cholesterol, doctors put people on statins when it starts climbing over 200. You want to divide your total cholesterol by your HDL and get your ratio. You want the ratio to be 5.0 and under. That's how you read cholesterol. You don't put fear in people saying, oh, if it's over 200, we need to start doing aggressive statin therapy on you here. That is not it. These are the things that we run them through here. Now, this is a very cool patient here from Belgium. 79-year-old male from Belgium. Good patient of mine here. Came across some YouTube stuff there. He said, I'd like an alternative to my beta blocker. My MD keeps pushing me to have more. Blood pressure was originally 150/90, which really wasn't that bad anyways. Now it's about 130/90 on the beta blocker there. And you want the no heart attack, stroke, nothing that ran in the family there. So on top of Belgian doctors who don't know how to run the right blood work, I had to read French blood work here and had to go through the French blood work here to find out what was going on here with them. Vitamin B12 was off there, and you got the folic acid, high ferritin. This is an iron component and parking iron in your liver. That's an inflammatory component there. Fibrinogen, one of the inflammatory markers that we run, that was elevated. That's a clotting factor that will cause heart attacks, strokes, and that kind of stuff as well here too. HDL was elevated. C-reactive protein, which is high with infection and inflammation, that was elevated as well there too. Homocysteine was the big factor here. That was highly elevated. I cannot believe he was 79 years old and had not had any cardiac issues or problems. That's a big, big marker to get overlooked there. I got his iron under control. I got his homocysteine under control. getting those 2 inflammatory markers under control. It dropped his C-reactive protein, got him off his beta blocker, and he says, I feel much better. I feel much more myself. The fuzziness is gone. The high homocysteine, the beta blocker, was giving him a fuzziness that he thought he was kind of going into having some memory type problems here. This is what the medicine's doing to people here. Very cool case. This was around the time Ebola was the big thing, and I was like, you know, our media is scaring us about Ebola, which we don't hear about anymore. I'm like, what's going on over your side of the world? You guys hearing much of that? Nah, you know, we're word of mouth. We talk, you know, newspapers, this and that. He's like, your country thrives on fear and pushing fear and that kind of stuff. He said some interesting things too, not to get super political or anything, but he was saying, yeah, I think Obama's reminding me of some of the communist type guys around us here. Interesting enough there. So let's move on here. Myth number 3, lowering cholesterol prevents heart disease. Truth is, statins are the most profitable medications in the history of Big Pharma. They are promoted as the go-to medications to prevent and treat heart disease. A recent study found nearly 100% of men and 62% of aged women 60 to 75 should take a statin medication even if their cholesterol is in normal range. This is the junk we hear from, this is what the medical doctors are reading. This is why everyone's on statins. Statins brain function here. Statins work by poisoning a certain enzyme in your body that helps produce cholesterol. Guys, say goodbye to your testosterone. Women, say goodbye to your hormonal problems here too. All of these things, lowering your cholesterol, you will create hormonal problems in your body here. The big thing down here is brain function. There are 36,000 reports of brain dysfunction, including memory impairment, transient cases of global amnesia, confusion, paranoia, disorientation, depression, and dementia related to statin use. Your brain is 60% cholesterol. Lowering your cholesterol, this is what you're going to see, and I absolutely believe all the dementia and Alzheimer's stuff that we're seeing today highly correlated to statin use with a lot of people. Statins do not prevent heart disease. This was a study reported in the Journal of the American College of Cardiology. They had 3 groups of people: high statin therapy, low statin therapy, and no statin therapy. The studies were found to have significant increase of coronary calcium scores when the groups were compared to the baseline. The high intensity group had the largest amount of calcium increase, and the low intensity statin group followed next, and then no statin was last. Calcium buildup is what's the plaquing on the arteries. So they're trying to prevent heart attacks and strokes, and yet the highest group of being most medicated with statins was creating more issues with calcium and plaquing on your arteries. This is interesting stuff here. Lipitor is the highest revenuing drug in the United States here. Maybe we should trust our heart to Lipitor. The French paradox. The French paradox is the French eat more fat and protein in their diet, and yes, there's less heart attacks, strokes, and cancer. There's other studies that showed that, you know, drinking a lot of the wine, they correlate the resveratrol, which is a strong antioxidant, works great for the arteries and that. This study here talks about, well, maybe it's the cheese and, you know, talking about the butyrate. This is something I'm going to focus on for next lecture here. I have found people that have been deficient in that specific area that have Crohn's and ulcerative colitis. And these are through stool samples here. Very intriguing thing there I'll be talking about at the next lecture there. Myth number 4, vitamins are expensive urine. Well, there's some truth to that because most vitamins are cheap synthetic urine. Dietary supplement fans got a big buyer's beware warning when the New York Attorney General's office ordered GNC, Target, Walgreens, Walmart to pull off a number of their store brand products off the shelves following an investigation that found they did not contain herbal components that were listed on their labels. If you want quality results using nutritional supplements, you want to use quality products. It's like driving a performance car. If you want a performance car to drive right, you're going to put premium fuel in it. You put leaded fuel in it, you're going to chug and blow out black smoke. You want nutrients that are strong for your body if you want to get the results you're looking for. Now, going back a few years, 2009, I believe it was, yes, 2009, they were pointing the finger at vitamin E supplementation increasing cancer rates. People were doing vitamin E supplementation, trying to work with, I believe it was the prostate stuff there, and they're saying, well, they were actually having more cancer. It's because they were using synthetic vitamin E. Even synthetic vitamins will create problems. You don't want the synthetics in your body, period. Myth number 5. You have too much acid in your stomach, and that's why you're having acid reflux. All your proton pump inhibitors, Nexium, Prilosec, Tums, Tagamet, Protonix, all those medications here shut off your stomach and inhibit your stomach acid secretion here. The truth is the majority of individuals don't have enough of their own good stomach acid to properly digest their foods. Acids of undigested foods typically causes the acid reflux. If you don't have enough good acid in your own stomach, carbohydrates will ferment, proteins will putrefy. Those rotting foods in your stomach will go north and give you acid reflux there. On top of taking those medications, this will create deficiencies in people. You turn off your stomach acid. You don't digest any of your minerals because you need acid to digest your minerals. You won't digest B12 because you need to activate the intrinsic factor to help you absorb B12. You don't break down your proteins, and you turn off your immune system to your stomach. That's big because so many people that we fix in the office, 80% of your immunity is through your gut. You gotta fix the gut. If you want to absorb supplements you're taking too, you gotta have good stomach acid there too. So the stomach's everything here today. And you watch too many people taking these medications for simple reflux issue, and everyone's stomach ache is a Nexium deficiency. Watch these older people taking these for long term. You're going to see early osteoporosis, stress fractures in the bones, and hip fractures and that kind of stuff from taking these types of medications. The apple cider vinegar test. Which direction are we going to go with the stomach? Do you really have too much acid, or do you not have enough good acid? 2 tablespoons of apple cider vinegar and 7 ounces of water. Take it on an empty stomach or after meals. If it helps you digest your foods and your acid reflux goes away, you need more acid to digest your food. If you take it and it hurts your stomach and it makes you feel worse, then that tells us you possibly might have gastritis or ulcer type issues. This is the simplest way to determine which way we're going to go with someone's stomach here. If you got a torn up stomach, then you got to say, well, are you taking too many NSAIDs like ibuprofen, Motrin, Advil, Tylenol? Is there an H. pylori issue? Is there a lot of stress in your life that you're giving yourself an ulcer? Smoking will create ulcers, so you got to answer these questions. And there's issues as far as gluten and other food sensitivities will cause gut inflammation. That could be a problem as well too. This was just last month here. This was a 35-year-old female diagnosed with silent reflux. I love that diagnosis. They don't have it coming up, but they think it's they think it's reflux, so they call it silent reflux. It's like fibromyalgia today. You got all these aches and pains. I don't know what to call it, but we're going to put you in the category of fibromyalgia here. Symptoms are metallic taste in the mouth. Has a sour stomach and sore throat in the mornings. Bowels are normal. Feeling of food getting stuck in her stomach there. That's a little bit of a hiatal hernia issue going on there. Now the metallic taste in your mouth. Now I was saying, if you're not properly digesting your foods, carbohydrates ferment, proteins putrefy. Those rotting foods, if they don't come up and give you acid reflux, if the gases of those foods that you're not digesting comes up, you'll get that metallic taste in your mouth. That metallic taste is a key indication of low stomach acid issue problems. This is just a few weeks here. Doing well. Has the taste has returned there. Slight metallic taste there once in a while there. Had to work with a few other things there and still work with the stomach, but she's doing a lot better there. It's just amazing how simple things like that go completely in the wrong direction. Now I told her, let's do the apple cider vinegar. Let's see if that hurts your stomach or not. I don't know which way easily to go with that stomach there. Hypochlorhydria, which is low stomach acid issues, and dementia. Low stomach acid issues are correlated to low B12 levels because you're not digesting those B12. H. pylori infections, because low stomach acid issues, opportunistic infections could occur in your gut or even go south and create problems. Hyperhomocysteine anemia, high homocysteine, because you need those certain B12 factors and things to lower the homocysteine. And high homocysteine is also correlated not only with the heart attacks and strokes, but also plaquing the arteries of the brain, creating a lot of dementia issues with older folks there. Bacterial overgrowth and food allergies. Food allergies are defined as undigested proteins, and you need acid to digest your proteins. So this is how food allergies are correlated to low stomach acid issues. And this is just the range here, talking about the homocysteine. 0 to 15 is typically the scale. We like to see it under 10 here. And that gentleman from Belgium on my Skype patient was 22. I've seen people have strokes and clots on 11s and 10s with perfectly good cholesterol numbers. I just had a guy in here today. What I did in front of his doctors with him is completely blown everyone away. He's on a liver transplant list. He had cirrhosis of the liver, drank his liver to death, and he was on a liver transplant list, and his liver enzymes were through the roof. I got his enzymes down to normal. His liver's functioning better. He's off the liver transplant list. He came back in today because he had a heart catheterization, and he was completely plugged up, and they put some stents in him. And he came back and his homocysteine was 15. His cholesterol was only 150, 130, 150. They would have probably just put him on more statins to drive his cholesterol lower when it was the homocysteine. You think that homocysteine is an important factor? Guarantee you this is something that's getting heavily overlooked today. Alzheimer's disease or B12 deficiency. If you're low on B12 as you get older, it mimics Alzheimer's symptoms. And here's your symptoms: memory loss, agitation, weight loss, fatigue, weakness, constipation, poor balance, depression, all that kind of stuff here. That is an important level to check as you're getting older. Screening for cancers catches it early and saves lives. Myth number 6 here. Now I'm pinpointing this one a little bit right off the bat here with the PSA test here. Is this the test that's had its day? The prostate-specific antigen PSA blood test fails to recognize 8 out of every 10 cases of prostate cancer. Researchers from Harvard Medical University School analyzed the test results of just about 7,000 men who undergone the PSA screening test and discovered that it had failed to spot 82% of the cases of cancer. The PSA is such a gray zone area as far as detecting stuff, and that's elevated. What do they do next? Start poking holes and doing biopsies here. Unnecessary biopsies if it's not cancer here. I got one of the head doctors who treats patients. He does the Debunking procedure for prostates, which is just removing the entire prostate if the cancer is within it. Got him completely baffled with what I did with a patient in front of him. And I'm kicking my butt right now for not putting this guy's case on my lecture here tonight. I'll kind of talk about him briefly. He's probably about mid-60s, retired and all that. Living in Michigan, down in Florida, back and forth and that kind of thing there. And his PSA was going up there. I think it was, if I remember correctly, around 12. So he went to the next step, doing the biopsy. They confirmed a few different biopsies that there's cancer within his prostate. They did a Gleason score, which on a scale of 1 to 10 kind of tells you, if it's closer to 10, it's outside the prostate and could possibly be throughout the body. He did all this type of research, wasn't too sold on wanting to go the route of chemotherapy and all this kind of stuff. What was interesting though is he was on Coumadin. So he wanted this Debunking procedure done where they just remove the prostate and take it out and be done with it. Gleason score showed that everything was all just within the prostate, nothing was outside the body. So he's just like, I just want my prostate removed here. And I was confirmed by 2 different oncology places that yes, there's cancer in my prostate there. So he went to the head doctor. No one wanted to cut him open being on Coumadin because they're scared that he's going to bleed out on the table. So he went to the head guy who does the Debunking procedure in Michigan that teaches all the other guys that does this stuff. And he's doing a review of all the supplements and things that he was on. He's like, I got no problem doing this. He's like, I taught everyone else how to do this procedure in Michigan. Coumadin, I've worked with patients with this before. he came across a product that I had him on. I'm not going to say it, being recorded. He goes, "You're taking this one nutritional supplement here. Who's got you on this?" He goes, "Of all the thousands of patients I worked on, you're the only one who's been in this office who's been on that." He goes, and my patient's like, "Well, how do you know about this nutritional product?" He goes, "Well, I take it myself." He goes, "Do you have prostate cancer?" He's like, "No, but I don't want to be sitting where you're sitting at there." Long story short, they took out his prostate, sent it to the pathologist. They found 0 cancer when it was confirmed by 2 different places. Now, I don't treat cancer, and we make that very specific at the office there, but something that we were using there with him at the office, his body took care of what was going on there. It was very cool, and this doctor saw all his reports from 2 different places confirming that he had cancer, and the Gleason score being at a certain rate, and getting the pathology report, and whoosh, clean. This guy's trying to send me every patient like I'm treating prostate cancer. I'm like, no, I'm not. No, we're not going down that road. I'm not. That wasn't. You had a very special case there. It was very cool. I'm excited for him. Now this is the PSA. This is the prostate. Let's go to the breast stuff here. The mammograms. A study published in the New England Journal of Medicine indicated that X-ray mammography screening may save only 1 person for every 2,500 screened. Among the 2,500 screened, at least 1,000 of them will have a false alarm, 500 will undergo an unnecessary biopsy, and 5 or more will be treated for abnormal finding that would never become fatal. This is getting messy, and they keep changing things around. Well, when should I have a mammogram? Should I not? What age? The new studies have kind of weighing the evidence here, in Rutgers University here has said, well, it is better evidence showing between 50 to 74 as far as breast scans, as far as mammograms go. Anything below that, we're seeing more problems as far as false positives, unnecessary procedures, biopsies, so forth and so on here. And that just kind of continues with that same part there too. Now, anyone who's a patient in our office knows that we like to use thermoscans here. Thermoscans measures the heat thermography off your breast there. If there's a cancerous lesion, cancer draws more blood flow, which draws up heat, and you will see it on a thermoscan if there's some type of suspicious spots there. We're not against mammograms, but we're not for mammograms for preventative things of getting a yearly dose of radiation with things here. When people come back with something like this and it's high, then we want to look a little bit more into that. Then we would kind of refer to doing a mammogram from there. But a yearly dose of radiation for something like this is not what we went on to push in. This is what one of them kind of looked like as far as a report here. And it gives you a grade of a TH1 and a TH4. And this lady had a cancer here, and the higher end is a TH4 and 3 here. So, talking about the radiation, all the cumulative effects of your typical scans today. CAT scans cause cancer yearly. According to a study of the Archives of Internal Medicine, CAT scans alone will cause nearly 30,000 unnecessary cancer cases, which will lead to about 14,000 deaths. While 30,000 cancers is a large number, a New England Journal of Medicine study from 2007 estimated that the overuse of diagnostic CAT scans may cause up to 3 million excessive cancers over the next 20 to 30 years. These things will have a cumulative effect. And here's a chart showing all your radiation tests that are going to eventually add up. Heaven forbid you go through a cancer and they have to keep checking you with CAT or PET scans. PET scans should be right on the same level because a PET scan is a whole body CAT scan along with that too. This stuff adds up. And you better think twice before having that biopsy. An article in the Cancer Cytopathology reported that the commonly used biopsy method can result in complications. Fine needle aspiration. Researchers studied 96 subjects who underwent a thyroidectomy, removal of their whole thyroid. These same subjects had previously been subject to the fine needle aspiration of their thyroid gland here. So if they find that they think that something's cancerous, they go in there with the needle, poke holes in it to do a biopsy on it, to send it to the pathology report and kind of go from there. Now the point is, and this is just the thyroid stuff, you go to the breast cancers, you go to the prostate cancers. If you've got a cancerous lesion going on, poking holes in a cancerous lesion is going to spread the cancer. And this is where there's a gray zone. Some doctors will agree with that. Other doctors will say, no, you're full of crap. The needle tract that you create from that biopsy, things will spread if it's cancerous. If the lump or the bump and whatever is small enough, have a lumpectomy. You go through a prostate biopsy, they put a ton of holes in you. I've seen liver cancers, liver tumors. As soon as they've done the biopsy, their blood work and their health has plummeted down south very quickly just from that. Myth number 7. Cancer survival statistics are improving thanks to chemotherapy. Now, this book here makes a pretty bold statement here. Chemotherapy has an overall cure rate of at least best 9%. Usually for rare cancers, it doesn't affect in any way the solid tumor, which makes up 90% of all cancer cells, of all cancers. The cancer handbook, if you have family history of cancer or have had cancer, I'd highly recommend this book here. It's a 2-volume reference work that provides comprehensive overview of cancer research and oncology. It is a reference source, a resource that deals with both the scientific and the clinical disciplines of cancer. Very interesting stuff. And what's really interesting is they're getting into injecting viruses in some of these tumors to elicit an immune response to go after certain cancers. And they had a 60-minute episode of injecting the polio virus in people's brains, in their brain tumors, to go after brain tumors. And it was very hit and miss with certain ones of these, but they've had some success rate of eliciting an immune response to go after the brain tumor with injecting it with viruses. Very intriguing thing that they're doing. I forget which university was doing that though. This is why I will not run in a circle supporting pink during the fall. All your money you've donated, all the research over 5 decades or more, the death rate has only dropped. The death rate from cancer fell only 5% from 1950 to 2005. Look at all these other drops here, all the money, all your research, that much improvement. And they want your money to jack up, and I will be talking about medication rates and how we pay the most in our country here. But even looking at that, you go bankrupt treating yourself with chemotherapy agents today. It is ridiculous the amount and pricing that they're going with a lot of these medications. One of my other lectures that goes over a lot of the cancer stuff, the cancer killers, the causes of the cure. It's available on YouTube and DVD. If you want to check that out there, you could YouTube that there. Goes further into that realm there. Myth number 8 there. Fluoride in low dose is okay. Rather than strengthening bone tissue, fluoride causes osteoporosis. New evidence shows that fluoride can also cause damage to the central nervous system, causing brain dysfunction, lowering IQ, and possibly contribute to Alzheimer's disease. Fluoride pushes iodine out of your body. Chlorine, bromine also pushes iodine out of your body there. Water fluoridation. Over 60 years ago, in the U.S., water fluoridation was promoted in order to decrease the number of tooth cavities. However, even 60 years ago, there was no studies proving that fluoridation of the water would result in a decrease of cavities. Now, 60 years later, there's still no studies showing that there are any significant tooth benefit from water fluoridation. Data from the World Health Organization show that there is no difference in cavity rate between countries that do and do not fluoridate their water here. I've got a dentist completely baffled right now because the family that I'm treating, 3 kids, are going, 3 kids here, going against their dentist's recommendation of fluoridation treatment, and we're using some supplementation. They've been prone to cavities their entire life and everything, and the dentist is on top of them. Got to use fluoridated toothpaste, got to use fluoride, heavy fluoride treatment when I'm here with you and this and that. And we're growing cavities out of these kids. And she's like, I'm not doing your fluoride treatment, I'm not using fluoride toothpaste, and we're using some supplements. And the dentist is scratching his head. He's like, your teeth are better than all these other kids coming in here. You're not following what I'm doing. Like, he's very intrigued with what we're doing with his kids here. It's very cool stuff here. Now, talking about the kids in fluoride here, health consequences of iodine deficiency. Fluoride pushes iodine out of the body. Iodine deficiency is a significant cause of mental development problems in children, including implications on reproductive function and lowering IQ levels in school-age children. The consequences of iodine deficiency during pregnancy is impaired synthesis of thyroid hormones by the mother and the fetus there. Insufficient supply of thyroid hormone to the developing brain may result in mental retardation. Brain damage and irreversible mental retardation are the most important disorders induced by iodine deficiency. Iodine is huge for IQ for your children as they're growing up. Now, the next slide I'm going to show you was a discharge sheet from the hospital I was at, or from the pediatrician I was at with a follow-up for my wife. If you're breastfeeding your baby, we suggest you use vitamins with fluoride in it. If you follow these recommendations, you do not stand a chance. I thought this was a joke. This is what they're recommending here.
Wow.
Do you think they're reading any of the research and that kind of stuff there with iodine? I didn't think so either. Myth number 9, you should take a 1-a-day aspirin for heart health. More than half Americans, adult Americans, take an aspirin every day, even though it's going against medical advice. Around 80% of users are taking it as a just-in-case type remedy here. Just in case, you should take some aspirin here. 1 a day there. This just goes on here talking about studies don't really suggest that it works as good as what Advil, or not Advil, but aspirin advocates think it does here. What do I see? What do I see personally in the office? Well, I can tell you I've seen gastritis, I've seen ulcers, I've seen pancreatitis, I've seen GI bleeds in people, I've seen too much blood thinner problems and too much aspirin where people start bruising all like crazy on their arms. You see all these older folks with all this bruising on their arms. It's too much blood thinners there. Too much blood thinners will create blindness. You kill your vessels behind your eyes with too much blood thinners as well there too. Aspirin use will do that stuff there. Myth number 10, conventional hormone replacement therapy is safe. The Women's Health Initiative was a large study involving over 16,000 women who were randomly assigned to taking the conventional synthetic hormone therapy between Premier and Provera or placebo here. The study was supposed to last for 8.5 years. It was cut short because of the side effects, primarily of the Premier and Provera. Some of the side effects women were getting: 26% increased rate of invasive breast cancer, 41% increase in stroke, 205 increased rate of Alzheimer's disease, and also pulmonary embolism here. Now, guys, doing synthetic testosterone, this is starting to go that same route, and there's been highly more cases of strokes and heart attacks with guys doing synthetic testosterone. We've got a guy in our office, he's actually part of this whole lawsuit stuff with what they're trying to promote on TV and the commercials. If you've taken this testosterone, if you had heart attacks, call our law firm, yada yada, and this and that. And he was, his fibrinogen level was going through the roof on his synthetic testosterone, and that fibrinogen level seemed to plug him up there. But he was doing the testosterone, and before that, he didn't have any problems. Very interesting. So where we thought this was all just a female thing doing synthetic estrogen and that kind of stuff there with hormone replacement therapy is not always the case here. It's becoming a little bit more prevalent with the guys with the testosterone stuff now too. What's hormones, what's not hormones? My female lecture you can refer back to as far as addressing common female conditions. A lot of things that I feel bad for the females because being female, you're put in a category of you're acting out or this is because of this because of your hormones. Find out what's hormones, find out what's not hormones in that lecture. I see too many people also get pushed down the route of, well, you know, I don't know what to tell you, but you look depressed and put you on all these antidepressants. It's disgusting how many women are getting pushed down that route. And a lot of those antidepressants are fluoride based and will push iodine out of your body as well there too. Myth number 11. Modern drugs have conquered many diseases. The truth is that modern medicine has created more customers than cures. 50,000 people die from taking prescription medications that should have never been prescribed. COX-2 medications such as Vioxx and Celebrex were those two medications here. What if vitamin C killed 50,000 people last year? Do you think we would be hearing about that? And that would be pulled off the market? Absolutely. How did this stuff even get on the market in the first place is my question. Skewed literature by pharmaceutical companies to push their products and false literature is how this stuff gets on the market today. And I'll talk a little bit more about that too. Americans pay more for prescription drugs than any other country. According to the 2000 report released by the International Federation of Health Plans, Nexium, your purple pill here for acid reflux, costs more than $200 for U.S. patients in 2013 and only $60 for Switzerland. And the next most expensive price for the same drug was the Netherlands at $23. We are getting hosed at these prices here. Myth number 12. Medical research has come a long way. Top doctors could be charged with fraud if they continue with the common practice of ghost authoring, where they appear as a writer of research often prepared by a PR firm, leading lawyers say. The practice gives false authority to supposed research articles that doctors rely on when they are prescribing drugs, medications here. Ghost authoring has been around for many years and they fill up to 80% of prestigious medical journals, one researcher has estimated. This is how some of these things get pushed on the market that probably shouldn't be on the market here. Pretty intriguing stuff, isn't it? New England Journal of Medicine editor. No longer possible to believe much of the clinical research published today. Dr. Marcia Angel is a former editor-in-chief of the New England Journal of Medicine, arguably one of the most prestigious journals on earth here. She says it's simply no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians and authoritative medical guidelines today. This head chief doctor saying you can't trust what's being put out here today. You gotta follow the money. Who's benefiting? Follow the money trail here today. Myth number 13, vaccines don't cause autism. I'm not saying that vaccines are the sole cause of autism, but I'm highly suspicious of what vaccines are doing today. I want you to look at these charts here. Look at the rise of autism. 1980 all the way to 2013. Look at the increased rates of autism as we go on. What's happened from 1990 to 2013? Look at your vaccine schedule from 1983 to 2015. You better start questioning what you're putting in your children's bloodstream today. It's as simple as that. Actually, it's not as simple as that. And I'll explain that even further here. This subject is absolutely beating a dead horse with the whole vaccine stuff here. I explained in my last lecture, Inside Your Brain, advanced lecture on brain health, what they are actually doing to your brain with certain vaccines. And that was a lecture based on Dr. Russell Blaylock, who's a very renowned neurosurgeon, very respected as well there too. You could check that out on YouTube. This was back early last year here. Dr. Thompson admitted that in 2004, the CDC study was altered to hide that a 240 increased rate of autism in African American children who received vaccine before 36 months of age were compared to those vaccinated later. This is the stuff that gets pushed under the carpet and that you don't hear about here. Here's some other charts here, 1953, 1983, 16, 23, now 49 here. What's in these things? Well, you got aluminum, lead, mercury, foreign animal DNA, protein, live and dead viruses, other preservatives. You got some genetically modified food components in certain things now here today too. Question mark. Don't know what question mark is. You probably want to find out what question mark is. I had a patient, and this was a great story too. The mom brought her child in to see me. She was saying, the hospital's giving me crap for me not wanting to vaccinate my child. She goes, what they don't know, my husband works for Pfizer. He's the biochemist that puts the things in the vaccines. Everyone that works in his department, nobody vaccinates their kids. What do they know? Maybe the public should know. But people want to believe the shadows and, follow the shadows. Now, like I said, vaccines aren't the only cause of autistic type things here today. Environmental Working Group here did a neonatal toxicity study of 10 babies born in the U.S. hospitals, 287 different chemicals found in the fetal blood system there. 287 different chemicals. Kid does not stand a chance right out the gate with that kind of stuff in their system here. I showed a pretty cool, talking about the pesticide stuff and kind of jumping backwards a little bit. I showed another little cool clip on our Facebook page of a family that went from eating regular foods to switching to all organic, and they were working with a lab that was doing blood and urine analysis on them and showing all the pesticides in their system, and as soon as they switched to organic, all of it disappeared there. Pretty cool video there that was going viral there last week. We are losing the war on drugs, and it's not to illegal drugs, it's to the pharmaceutical companies today. Here's your increased rate of ADHD drugs here today. Increase and grown by 89%. Just look at this climb right up and through here. This is getting heavily abused. A lot of these medications mimic cocaine on the brain. College-age people are abusing these. The women love them because it helps them think and it curbs their appetite and keeps them skinny. This is heavily abused. Can't tell you how many people that I've seen that are dependent on these things just to get going in the day because it's a stimulant now. Americans spend a record amount of on medicine in 2014. Americans filled 43 billion prescriptions and doled out nearly 374 billion on medications in 2014, according to new data from the IMS. The data shows that American men and women spending on medicine hit the highest level since 2001, up 13% in 2014 compared with the year before that there. Now, I'm 33 years old, which I'm held against, or things are held against me just being young and knowing what I know and seeing what I've seen with things at the office here. I've worked at Diverse Health Services for going on 7 years. I have not had one sick day working at the office. I haven't had one antibiotic since I was 15 years old. I haven't had one NSAID, ibuprofen, motion-able Tylenol, since I was in my early teens. I guess what we do at our office must work. My first half of my life was destroyed and and someone might say, well, maybe you just have a strong immune system. No, I don't. I had strep throat and earaches growing up my entire life. And my mom was a nurse, so every sniffle, cough, sneeze, it was an antibiotic. Where are you going to get your calcium if you don't drink your milk, plug up your ears, antibiotic year after year? Ugh, same infection. It's amazing when you wake up to the different avenues of health, the different ways you could treat things. It's awesome and it works, and I love what I do. Oh, going back to baby Ethan here. He was born last month. I was rushing to get back from a Tigers game. I had some good timing. The Tigers weren't doing that good. I left early that day, and my wife's on the phone. You might want to get home. I'm having some contractions here. Rushed to get home and everything, and it was a fast birth. We got at the hospital at 8 p.m., and she delivered at 10:27 p.m. She delivered at the Alternative Birthing Center out in Southfield, Providence. Used the doula. Nurses were absolutely phenomenal there. I cannot talk highly enough of where she delivered at there. The rooms set up like a hotel. You got a queen-size bed, jacuzzi, and all that kind of stuff there. It was absolutely phenomenal. Point being, she took the pregnancy protocol that we use at our office, and she got adjusted by me throughout her entire pregnancy. I got a bunch of friends who are pregnant right now too, going through pregnancy. She did not have morning sickness. She did not have the aches and pains and the problems like all of my other friends I know taking synthetic one-a-day prenatals. You use quality nutrients, you won't have the problems, and getting adjusted regularly typically cuts down labor length from chiropractic research there. It was pretty cool there and just an absolute phenomenal experience here. And like I said, you got all that hair. It definitely wasn't me or my wife there. That was all minerals right there. Now getting back to kind of the Joel Wallach stuff here and the mineral stuff here. 85% of our soil's depleted of minerals. If the minerals aren't in the soil, it's not in the food, it's not in us. I don't care if you're a vegan, I don't care if you're a vegetarian, I don't care if you're a paleo, I don't care what you eat today, the food is dead. No, I'm going to prove it to you. Actually, I already proved it in one of my previous lectures. I'm going to let you prove it to yourself here. This is a Brix meter here. You could go on eBay, buy one of these Brix meters for $50 or something like that. You squeeze your fruit and vegetable juices on this Brix meter and put the flap down, and you'll measure the actual density of what you're eating here. Now, what I didn't talk about in my previous lecture is after a few years, I was giving this to patients and having them go around and checking out different stores and that kind of stuff. Our findings. Stores like Walmart, or actually stores like Kroger, Meijer's, test it very low with their fruits and vegetables. Walmart organics surprisingly checked very high. Your Better Health, Whole Foods checked pretty good. What checked the highest of all those stores? Foods in your own garden that you raise on your own checked the highest versus these stores. Grab one of those, do your own, let me know what you find. This was pretty cool going around the last few years playing around with this thing and measuring the foods. But the food is absolutely dead today, and this is how you could prove it to yourself. As far as, doctors dying at age 58 and this and that and life expand, I can't really talk too much in depth as far as that goes, but National Geographic did a study as far as blue zones go. Blue zones are where people live to be about 100 or over 100, and they study these people, and they had their list, which I'm not going to go through, as far as what does it take to be 100, this and that. The most intriguing thing on this list, or that's not on this list that I found pretty good, is these little blue zones were islands and just obscure areas. There's no medical doctors around there. There's no medical doctors around these blue zones. Why? How they live into 100 if there's no doctors? I tell you what, if you want to cut your lifespan down 10 years, I'm going to send you to Florida, because all my patients at Snowbird down there, heaven forbid they got to go in the office for some type of health reason, they try to get them on 10 medications right off the bat there. But I thought that was pretty interesting and wanted to kind of share that there with you. The United States, first in healthcare spending and last in life expectancy. The World Health Organization has ranked us 37th overall. That's pretty ugly, isn't it? Isn't it time to wake up and take a different avenue as far as health goes and investing in yourself? Your health is what you invest in yourself, not what your insurance covers for you. Invest in yourself. Don't be a statistic here. Make an office visit, customize a protocol there for you. We use 3 different nutritional lines in through here: biotics research, standard process, and food research in through here. Ordering online there, free shipping over $125 there. These are some of my previous lectures on YouTube that you could find. And thank you guys for coming out tonight.